as we age, every decade of life, we gain more and more psychological resilience and our symptoms decrease. This isn't to say that people don't suffer and struggle and have real need. It's to say that we develop resilience at the same time.
Welcome to Zestful Aging Podcast, where I speak with changemakers from all over the world, from every walk of life, who will inspire you to live with zest. I'm your host, Nicole Christina, and my mission is to bring you optimism about aging and help you make full use of the new opportunities that only come at this stage of life. And to find out more about this podcast, hop on over to zestfulaging.com. Did you know that the majority of older adults with mental health concerns do not get the mental health care that they need, resulting in worse medical problems, higher healthcare costs, family strain, and needless suffering? Loneliness, depression, and addiction are just some of the challenges older people may face. Well, today we're going to be speaking with Dr. Regina Koepp, a gerontologist and aging expert, and we're going to focus on the complexities of being an adult child and wanting to care for our aging parents in a way that's appropriate, that honors their independence, but also make sure that they're safe. This is a pretty tricky role, and that's why we're going to talk about it today. We're going to learn what's potentially helpful and what is definitely not helpful, and we're also going to learn about resources that are available to assist older adults with mental health challenges. Dr. Regina Koepp, thank you for joining us.
Thank you so much for having me. I'm delighted to be here.
You know, you really are a trailblazer. I'm sure you've been told that a million times. You've started your own, I don't know if movement is quite the right word, but you really have a clearinghouse for mental health and aging. Would you say that's accurate?
Yes, I want it to be a movement. Let's make it a movement. Yes, my goal is to improve mental health for older adults, and one way that I do that is by making sure that people know what mental health looks like among older adults and what's typical and not, and how to help.
Mm-hmm. Yes, and I remember when I was working at Stanford, and we had talked about that off mic, that there was real attention paid to antidepressants for older folks, because some of them that are fine for middle-aged adults are definitely not fine for older people. And maybe that's an example of how older people have their own needs and their own concerns.
Yes, I think that is true. I don't want to discourage people from antidepressants blanketly, because there are very good benefits from antidepressants. There was actually a study recently published that looked at older adults with mild cognitive impairment and depression, and they found that consistent use of antidepressants, I can't remember which ones were in this study, actually delayed dementia by 3 years.
Wow.
And so I don't want to discourage the use of antidepressants.
Not at all.
Though there are considerations, like you're saying, to prescribing, because if the person has cardiovascular issues, you know, they have to navigate that with their doctor, what's best for them. But we definitely, there are unique considerations, and treatment is possible, and it works. It's very effective.
Yes, you make that very clear in your talks, and that it is so, I don't know, easily treated, but it is very effective, and we need to address that. And I just thank you for the clarification. I just remember the physician saying, well, this one works well, this one we don't use. So there was just some discernment about what antidepressant would be appropriate. So talk a little bit about some of the mental health issues that might turn up with our aging parents or aging loved ones?
Yeah, I think this, first, I just have to applaud you, Nicole, for addressing this topic. It's an underrepresented topic, and it's so important because mental health is inextricably linked to physical health and spiritual health. And if we're only looking at the physical aspects of aging, we're missing most of the picture. Physical aspects of aging are maybe a quarter of a person's experience with aging. There are psychological, spiritual, social aspects of aging as well. And so the sort of common concerns that come up with mental health for older adults, let me just back up again and say, as we age, and this is true for every age cohort, as we age, we become less and less symptomatic with mental health problems. And so young adults have the highest symptom profile with mental health concerns. And then as we age, every decade of life, we gain more and more psychological resilience, and our symptoms decrease. This isn't to say that people don't suffer and struggle and have real need. It's to say that we develop resilience at the same time.
And it looks different. Is that what you're saying?
Yeah.
So depression may look really different with an adolescent or a young adult. And you're saying because of developmentally where we are, we're not going to look for the same things.
Yeah. So it might not be as prominent. So depression might not be as prominent as we age. There's less diagnosis of depression and anxiety and other mental health conditions. This is with the exception of insomnia. Insomnia is worse among older adults than other ages. And there are reasons for that too. However, so what depression looks like though is about what we see, and some of the research shows, and I will say research is limited for older adults' mental health, so everybody just needs to consider that. What we know right now is that some studies show that the first episode of depression, when we see depression later in life, it's often 50% of the time, it might be the first time the person's ever been depressed. And so late life depression is unique in that the person may have never been depressed in their life before, and then all of a sudden they have a life-altering medical problem or a significant loss or a big move or retirement, and nothing purposeful has filled its place, retirement's place. And then the person starts to experience maybe a depressive disorder or an initial unspecified depressive disorder, something more mild to something more serious. And what that might look like you said, is very different for older people than younger people. They might have more physical complaints. They might have more concerns about their memory or fogginess with their day-to-day functioning. They might be a little more irritable or withdrawn socially. And where other people might be more sad and tearful, maybe older adults are experiencing something else entirely or describing something else entirely. And also there's the language that young people have to describe their mental health experience. Older people didn't get that same language. We really did older people a disservice around mental health expression and asking for help related to mental health concerns. And so there isn't the same language generationally around mental health and mental health care as there is for younger people. And so they might not even be using the same language you're looking for if you're an adult child.
And if we look at the World War II generation, just generally, as I mentioned to you earlier, I do some volunteering at there's a veterans center near. I can't imagine some of these. Well, the vets, they've fought in the war. I can't imagine some of them saying, I'm just feeling really hopeless today. Or, it's like pull yourself up by the bootstraps. It wasn't that generation where we would talk. It was more stigmatized. Is that congruent with what you found?
Yes. Yeah, there's so much stigma around mental health for every age group, I would say, and then especially for older adults who were told just to suck it up. It's a weakness. You're going to go to see a therapist, they're shrinks. They're going
Mm-hmm.
to hospitalize you, medicate you. They they won't get it. You don't need that. All of these messages get internalized, and we really did older adults a disservice with these messages. It wasn't until the 90s that there was even treatment for PTSD for combat veterans. And I worked at the Atlanta VA for more than 10 years and with older adults there, and worked with many World War II veterans, actually. And so, their family member might bring them in and say, I'm concerned my loved one. And actually, what's interesting, since you brought up World War II, is that about 90% of older adults, people 65 and older, have experienced at least one traumatic event in their lifetime. It doesn't have to be combat. It could be a car accident or the loss of a significant person, the loss of a child. And what's interesting is that as we age, PTSD or post-traumatic stress symptoms, not necessarily the disorder, can emerge over time, like even decades later. And this is because sometimes what we used for our coping mechanisms in the past, say we were working a 9-to-5 job and we had a very structured life, and that helped us to keep these memories at bay. And so I was just able to keep those memories separated from my life. And then all of a sudden you retire and the memories come flooding back because there's not the coping, the structure, or maybe you get a new medical diagnosis of cancer or a cardiovascular condition, or you have to have a triple bypass and they have to open your chest and it's traumatic.
Oh, yes.
And then what I say is new trauma calls into the room old trauma. And so then the person is reckoning with all of these historical experiences. And so these are unique for older adults too. And I want to just also say, it's not like young people don't experience this and older adults do. These are human experiences. And it's just a way for us to be thinking about, how might older people manifest these symptoms differently? What do we need to be considering that's not in the public eye or on social media about how these symptoms are manifest?
That makes so much sense. And you know what I'm thinking too is, I know you had a podcast about retirement and what that's like, and when the honeymoon's over, it's often problematic. But I think also older people are coming face to face with profound ageism, if they haven't even experienced it before, and perhaps face to face with their mortality. And we are so poor at talking about death and dying in our culture. There's so many things to navigate here.
Oh, there is so much, which is what makes it my favorite, the richest population to work with, because not only as we age, we will decline, we will get sick, we will have limitations, our body will fail us. Our biology is designed to do that. And we can delay that process and be optimally healthy, which is what I want for everybody. And still, we all will die. And what we don't talk enough about is that, yes, the body will decline. And another remarkable thing happens, that as we, Erik Erikson, who's the godfather of developmental psychology, says something like, as we approach the end of our days, we're asking ourselves, was my life meaningful? Mm-hmm. And then we bring together the strands of our lives to make an integrated whole. And that process of creating an integrated whole in understanding our story and doing a life review and bringing the strands of our life together and weaving it into a beautiful tapestry, that is a psychologically and spiritually healing thing to do. It's very rich and meaningful and purpose-driven for many people. And that's a part of the aging experience we don't often get access to, that this is, yes, there is hardship and there are life-altering conditions and there is loss and there is post-traumatic growth and there is psychological and spiritual healing that can come of that. And that's one of the messages I hope to share, that aging is not just full of limitations and loss and decline. It has this an entire other world of richness and depth and meaning. And if we allow it, can be very, very healing and transformative.
What a beautiful message.
Hey, Zesties. Well, I'm pretty sure I'm not the only one feeling tense and anxious these days. Every day, it seems like there's more scary news. Well, I've been a psychotherapist for over 34 years, and I've learned a lot of techniques to help manage anxiety, and I've been using them. But recently, I found something new that I wanted to tell you about. I actually just stumbled upon it at an event for veterans. It's a little breathing device called Calm Ego. And when you're breathing in a way that promotes relaxation, which is basically long exhales, it lights up. And you can add a calming scent if you like. So Calm Ego is a natural, portable, drug-free solution that can be used in moments of upset, anxiety, and stress. And it's effective and pretty unique. And you can use it for both immediate relief and also long-term effectiveness. So I love that you don't have to think about the breathing, you don't have to count, you don't have to imagine a square, you really don't have to do anything. It does all the work for you. I find it to be especially helpful before bedtime, and I'm pretty excited about it. So I'm partnering with Calm Ego to offer you a 25% discount if you use the coupon code Zestful when you're cashing out on the site, which is Calm Ego, CalmIgo.com. And please let me know about your experience. I will be interested to hear. Thanks.
I often think of it as walking a bit of a tightrope, that you don't want to sugarcoat. I'm still working on a wonky knee, and I haven't been able to play pickleball for weeks, and I'm really mad about it. So there's that. But then there's also meeting these new friends that I know through the podcast or whatever. It is this balance, it seems to me, of navigating the loss, metabolizing these losses while also appreciating some of these benefits.
Oh, it is that, because it's such a juxtaposition. You're filled with constant setbacks. Your life daily. Like, I can't drive this month because I'm getting cataract surgery, or I can't. There's the knee that's setting you back with your pickleball, and then there's something for somebody else, and it is filled with my friend died, or this really important person in my community died, or so many setbacks. And the remarkable thing about grief, and I think it's a kind of a perpetual grief that could be happening, is that there can be joy and perspective and possibility. Like your example, I can't play pickleball, and then I'm also now paying attention to all these other opportunities with the podcast. And so if you could keep the open heart and the sense of possibility and curiosity about your life, I think that's like the ticket in.
Oh boy, is that beautifully summarized. And I think one of the expressions I don't like, and I don't want to be offensive, but age is just a number, seems to me a bit trivializing. I mean, the number means something. The number means that I can't do the same things that I did 20 years ago because my body my knees didn't hurt. I feel like it trivializes it and to sugarcoat, like, yes, as you say, there is loss. Unless you are pretending otherwise, that's the reality. So how do we do both at the same time is see the loss and feel the loss while at the same time saying, I have a different perspective. I have choices that I didn't have as a younger person. That's, to me, as you say, the ticket in. I see that as sort of that magic balance.
Yeah, and I think you're right. I think there is this sort of movement of being age blind. Like, well, age is just a number is an example of that. And I don't think that's fair either. I think, like you're saying, it doesn't acknowledge my real lived experience that comes with age. And so I agree. I don't like the age is just a number. I don't like, we don't talk about our age here. I don't like, I think it's like another identify. I'm a woman. I am a cisgender woman. It's part of my identity is my age. I'm a 49-year-old woman. And so, and what 49 means, right? And what's interesting too is that it is not just a number, because also age connotes stage of life. And so what's interesting is I'm a 49-year-old woman, but my stage of life is kind of tricky because I had kids in my 40s and my husband's 51. And so our kids are 8 and 9 years old. And we have friends and people we went to high school with who are grandparents. And so our our age, 49 and 51, we're middle age, but our stage of life is like we're 10 year, we're more like people 10 years younger in terms of stage of life. And so that's been interesting. But I think something similar, it gets complicated with aging because we're also saying older people are 65 and older. Well, if the oldest person lived to 122, which is what's documented, that's almost 60 years of life. Like how can we clump all those people together into one experience? Like everybody has a unique experience. And I think what we're speaking to is there's a universal experience of aging and of knowing that we will all die. And then there's a unique experience each of us have in the aging process and even in the death and dying process. And so how do we hold both? Like that tightrope again, like how do we hold grief and joy? How do we hold that we'll all age and our bodies will decline and possibility and hope?
And back to being an adult child, how do we support our parent who's a caregiver, let's just say in that scenario, wanting to honor independence and their own relationship, their own married or relationship or their partnership, but also be available if they need some extra help, some extra perspective?
Yeah, I think this is such a great question. A lot of adult children who see their aging parent experiencing physical decline or cognitive decline or changes or relationship challenges or maybe making unhealthy choices in their life may wonder, when do I step in? And so I call this sort of ambiguous caregiver stage where the person is thinking, okay, now I needed to step in and help because my older parent was in the hospital and my other parent is getting cataract surgery and couldn't drive and, like all sorts of complications. And then that all stabilized and now I'm stepping out. And so when do I step in and when do I step out? And now I'm caregiving, now I'm not. And when do I know that it's my time and when do I not? And sometimes they don't ask for help because they don't want to be a burden and they want me to live my life. But sometimes I'm really concerned about them and I want to know what's going on. So often adult children are in this really ambiguous place in their relationship with their parent about when do they need me, when do they not, and when am I overstepping and when am I avoiding. And these can be difficult paths to go down without guidance and support. And so I think one of the things that can be very helpful is, if possible, to strengthen the relationship, just the relationship, not the caregiving dynamic, but to strengthen the relationship between the adult child and the parent. And because the more trusting the relationship, the more honest the person will be with you. And the more you'll have a better sense of what's going on. Every family approaches aging with their own family dynamic. So if the family prior to aging, to a medical complication like dementia or cancer or another life-altering medical condition, maybe Parkinson's, maybe in the past the family is very secretive and the adult child wonders, am I getting all the information that I need about this? And maybe they're not because the privacy quotient is high for the older person. Or maybe there were betrayals in the family. And so then they don't trust the information that they're going to get. And so if that relationship is important to you as an adult child, how can you strengthen the relationship authentically without pulling in all the caregiving dynamics just yet? If that's possible. That might not be possible, but if that's possible.
That's great advice. And then, of course, we bring in if there's siblings, and that that can be super complicated depending on the earlier dynamic and who's going to be doing what. And people have very different ideas about what's appropriate.
Truly. And here's what's so complicated about older family dynamics is that the adult children have differentiated themselves from each other and from their parents. And they have each of these groups of people have their own unique lives. And so when somebody else steps in and says, this is how you should be living your life, nobody likes that. Somebody steps in and says to an aging parent, this is how you should be living your life. And then that aging parent contacts the other sibling and says, hey, your sister just told me this is how I need to be doing things, and I'm not happy about it. Sometimes the paths of communication or what actually gets expressed gets a little bit distorted, like the game of telephone.
Yes.
And so then siblings are at each other's throat because mom or dad didn't like the way that you presented this. And then the sibling who was the concerned sibling to begin with is like, well, you don't understand. You're not here doing this hard work.
Yes.
And so it creates all of these challenges. And so the more the siblings are able to get on the same page, the better. But also to even have shared conversations with the parents, like having family meetings. And this is tricky because maybe the parent is not in the mood. Maybe they don't want it.
Yes.
Maybe they feel that their children are overstepping, and the children might be. And so it can get really complicated. In these complicated situations, I'd recommend maybe a family therapy session with a geropsychologist or somebody who specializes with older adults, who does psychotherapy with older adults and their families.
Which you pointed out, there are not an awful lot of.
No, and I'm trying to change that. So I have the Center for Mental Health and Aging. We train mental health providers to work with older adults and families. And then we have a national provider directory that's free to use, where you can find a licensed mental health provider who specializes with older adults and their families. Sometimes also you might not need therapy, you just might need an expert. And there are experts called aging life care experts in every community, and they can come in and meet with a person in their home and assess what's going on and give feedback to the older person in the family about what's recommended. Sometimes what happens too is adult children project their own fears and dread about aging onto their aging parents sometimes. And the older parent doesn't see it that way. They're having a very different lived experience than the projected concerns that the adult child has. And so they've adapted to these changes one step at a time where the adult child may not have. And so they could be at very different places. There was a study by AARP a couple of years ago that found that as we get older, like 70, 80, our fear about dying is decreased and our preparation for dying is increased. Whereas when we're 40, 50, our fear of dying is high and our preparation is low. And so we might be projecting our own fears onto an experience of an older person that might not be their experience.
You know what it comes to mind, and you're doing so much, you're devoting your career to rectifying this, is that we're so poor as a culture talking about this, supporting it, having it be a conversation and be out there. We have a local death cafe, and I always think that that's such a wonderful resource for people to just give voice to. What do I do now? And, nobody's talking about this. Maybe we can talk a little bit about what you offer through the Center for Mental Health and Aging, because you have a lot of resources going on.
Yes. Yeah. I don't want to be harsh to the adult child just for a second. I was thinking about this as you were talking that, I get it. The adult child is concerned and has legitimate concerns and has fear and legitimate fear, and how to maintain your own concerns and fear without it bleeding into the relationship. But then how do you express that to your loved one in a way that they can hear it? And I think that gets really tricky. And depending on your family dynamics, some people have an easier time than others. But it makes sense that it's happening if it's not going well, and you could get some support for that. And so what we offer at the Center for Mental Health and Aging is we offer continuing education courses for licensed mental health providers and aging services providers, like aging life care experts, so that they know what to do, how to identify mental health concerns in older adults, how to treat mental health concerns in older adults, how to work with families and family caregivers and navigating complex medical problems, end of life psychotherapy and ethics. And then we have the National Provider Directory to improve access to mental health care, because one of the reasons older adults, like you gave that opening, which was so important for people to know, that when mental health conditions go untreated, it increases it worsens medical problems. It increases medical hospitalizations and ER visits, increases the use of medication for medical problems, increases family strain, and so much more. And if we could get them, it's suffering. And if we could get people treated, it would reduce that. So what we do, or our ambition, is to educate people what is happening, what's typical and what's not, and what to do when it's not typical, and how to navigate this. And so we give lots of free information and videos and resources to professionals and to the general public.
What a wonderful clearinghouse. You've got so many different facets of this going on.
Hi, Zesties. Well, we all know that exercise is really important, especially as we age. Some say it's the most important thing you can do to stay healthy. But many of us find that it's really easy to start an exercise routine, but it's hard to keep it up. That's why we see so many exercise bikes and machines being used as clothes hangers come March. Am I the only one who has bought a gym membership that turned out to be a total waste of money? At this point in life, I want to do things that are good for me, but also fun. You'll never find me at a class called boot camp, because life is hard enough. And that is why I love my rebounder. What is a rebounder? Well, it's a mini trampoline that has so many health benefits, it's kind of crazy. It turns out that gently jumping up and down provides excellent benefits to our whole body. It helps clear lymphatic drainage, which is basically toxic waste in our bodies. And get this, NASA uses it to help their astronauts reacclimate when they've been up in space. And I'm not even going to go into the improvements in complexion and mood. Let's just say it's hard to be in a bad mood when you're jumping to your favorite music. It's like your own dance party. But if you're interested in a rebounder, please take my advice. Don't buy a cheap one. They can actually be dangerous. I would recommend the one I have, which is a NEEDAK rebounder. It's NEEDAK, and mine's going on about 20 years old. I use it with light weights, and I've actually used it to train for the senior tennis games, as well as my Camino walk in Spain. And it's also great to use in upstate New York in the winter when the weather is awful, which is pretty often. So right now you can get a free rebounder cover at NEEDAK if you use the coupon code ZESTFUL. So again, NEEDAK, NEEDAK. And if you have any questions, check out my YouTube demo. It's my most watched YouTube to date. So happy jumping, and I would love to hear how you like it.
I'm wondering if you're seeing people, physicians, other clinicians being more aware of these complexities as the baby boomers are aging and as we have more and more older people. Are you seeing some improvement in our ability to address the mental health issues of older people?
That's such a good question. I have not seen a ton of growth in this area, which is why I am trying to change that. I will say, I no longer work in a large medical system, but I have worked at Stanford and Emory and the VA and University of Vermont Medical Center, and I've seen, firsthand everyone from the radiologist to the medical lead of a department not know what's typical with aging and not aging related to mental health. And I think that the people are very caring and very concerned.
Well-meaning, I'm sure.
Yes, and compassionate, and they just don't know. They just don't have the information. And which is why I created this clearinghouse. But because they would approach me almost weekly, I have this patient or I have this loved one, and tell me, what can we do? And then, we're just talking about aging. When we get into diverse identities within the aging population, we see lots of missteps and miscommunications based on race or racism and sexism and queerphobia. And like all of that also intersects with the lack of knowledge. And so, most people don't look, or most professionals don't look at an older adult and think, oh, you're gay. We look at an older person and think you're straight. Or we don't look at a person and say, oh, I need to assess for substance use. So we make assumptions based on and this is true for everyone, not just professionals, but I wish it was better. And I think we have a long way to go. I think that hopefully with the sort of zeitgeist around aging and longevity, people will be more curious about mental health as well, and the intersection of mental health and physical health.
And how ageism is this, this template that rests on this, where if older people are not valued, then why be curious? That they're kind of past their prime or whatever the thinking is. That I think that would weigh really heavily on this and get in the way of people saying, are you straight or are you gay? And is that something you want to talk about? Does it matter?
Right, because they're not even being seen.
Exactly. Yeah. Does it matter? Do older people matter?
That's right.
And then underneath that is, and what about their mental health?
Oh, what about what they want to do in life? Even if they're 97 and bedbound, what are their wishes? Yeah. What do they have left they want to experience? What brings them joy? And I think we have a long way to go. Ageism is one of the significant barriers, stigma, and ageism, as we're talking about, which leaves older people invisible, irrelevant, professionals thinking, a bother. Of course, you're in pain. You're older. What do you want me to do about it? Like there are these this sort of cast that we're sort of casting people off, and I think that's incredibly harmful. And we do have a long way to go. Also, there's just ageism. We're talking about internalized ageism, but also structural ageism, where graduate programs in medical schools aren't teaching about aging mental health or even geriatrics in medical school very often. And so, currently for mental health providers, less than 5% of mental health providers have any training with older adults. Yet in 9 years, there are going to be more people 65 and older than children under the age of 18. And there are so many mental health providers who specialize with children and adolescents. And so there is, I think, ageism. I think it's complicated too, because there are so many intersecting pieces with older adult mental health care. There's physical health and mental health and family and systems and support agencies, depending on the needs of the person. And so that becomes challenging for some professionals and time consuming. And how do you even learn about and find those resources? And so my goal is also to make that simpler by sharing information.
Mm-hmm. Yeah. Boy, there's so much to learn. Wow. I'm so glad we got a chance to start the conversation, and I really appreciate your work in this area. Where's a great place for people to go to learn more about your work and your offerings?
Yep. So if you want to learn more about what's typical with aging and not related to mental health care, or find a mental health provider for your loved one, you could go to mentalhealthandaging.com.
Mm-hmm.
And if you're a professional looking for continuing educations, you can go to the same place, mentalhealthandaging.com.
Okay. And do you have a social media presence?
I do. I'm most present on LinkedIn.
Okay.
But that's a goal.
Oh,
That is
soul-sucking.
It is. It's so hard to be present on those platforms. I'd rather read a book than
Yes. I'd rather do most anything than talk to the algorithm. But I know this stuff is so important. Thank you so much for your work. It was such a pleasure to spend the time with you today and have what's a very important conversation. And best of luck with your podcast and your all of your offerings.
Thank you so much. Thanks for addressing this really important topic.
Thank you so much for joining us on Zestful Aging. If you like the podcast, please share it with some of your friends. Our theme song is All I Did Was Wait for You by Kjartan Abel. Visit Kjartan-Abel, that's KJARTAN-Abel, ABEL.com to hear more of Kjartan's work. And our technical director is Stephen Litweiler. And stay tuned next week for another interview with a fascinating and inspiring guest. See you then.